I have been a nurse for over 30 years, and 20 of those have been here in Vermont. We're here to change what is politically possible. And when you look around the room, we know we can change what is politically possible. We know that Vermonters believe that health care is a human right. I don't think we need to sell that today. We know that's true. What we're here to do today is change what is politically possible. What we need to do is to get rid of the corrupting influences. Let's get back to people and health care. That's what it's all about. We need to stay focused. Health care is not a commodity, but a public good. We look at health care somehow separately. We look at our schools as a public good, our police departments, our fire departments. Why is it that we can't look at health care in the same way? We say we can and we should. No one should have to beg for health care. No one should be forced to buy an insurance product that really won't get them anywhere. Right? How many people do we know that have bought a health care product and they have a $10,000, $20,000 deductible and they're still afraid to go to the doctors? So you could say, okay, they're insured, but it's not going to do anything for that individual and for their health. We believe everyone is entitled to comprehensive, quality health care. There must be no systemic barriers to the care that we need and that we get. We think there's a lot of systemic barriers in the system now. We have, as I said, co-pays and deductibles that we just can't seem to, get rid of, and that people are looking at it because it's the product they can afford when they see that, yeah, they can afford the product, but they can't afford the care that they're actually trying to buy. The cost of financing the healthcare system must be shared equitably. It must not be that you're at the doctor's office and you're trying to figure out how to pay. I'm lucky. I was at the doctor's office yesterday, and I have a $5 copay. I'm one of the lucky. I consider myself lucky because I could be without insurance just as easily as the next person. I paid $5 for that doctor's visit. There are a lot of other people that were paying full freight. I also saw a sign on the doctor's office door when I was there that said that healthcare is the most important thing in life, and that if there were issues paying the bill, to please talk to them because there were applications that could be made up. So obviously this is what people are worried about, is how they're going to pay the bill. They need to be worried about their health, not how they're going to pay the bill. Healthcare must be transparent design, efficient in operation, and accountable to the people it serves. And that's to the people of Vermont. As the legislature continues to debate healthcare issues, we will hold any policy, any bill in this House to the human rights principles. In 2005, a bill was passed in this House that met the human rights principles. We would say, you did it before, you can do it again. What happened that time is the governor vetoed that bill. We know that is no longer a barrier. Yes! In 2010, the crisis is worse. I work in healthcare. It's been my life. I've been dedicated to it, inside and outside of the hospital. And I'm telling you, it's not getting better. It is not getting better. At work, we're looked at to do more with less. When you're talking about how you're going to have beds in a hospital and you're trying to figure out how not to staff those beds, I tell you we have a serious problem because people don't need beds. They need nurses and beds. They need doctors and beds. Based system, it's a problem, and I think we all know that. At the hospital I work at, we have insurance, but if you're a part-timer and you pay for the family plan, you pay $10,000 $426 a year. And that's working for a healthcare employer. If you're full-time for a family plan, you pay $5,226. And that's before you have your co-pays and deductibles. That's your premium. Businesses in Vermont are self-insured. That's a hardship for them. We understand that. We're in hand with them. We have an employer in the state that's a fairly large employer, was self-insured. They had a catastrophic event at that with one of their employees. It cost them so much they dropped their health plan. That's no solution. That is no solution. And then where were those workers sent? At that point in time, workers were told, well, go sign up for VHAP. It's not the solution. I have a son that moved back to Vermont last month, which makes me very happy. He bought a house in Burlington and he's working for a small business north of Burlington. He's uninsured. His employer is awesome. I love them. He loves them. They can't afford to cover him. So I have a young son who's back in the state without health insurance, and I'm a nurse. I have a son that works for the ski industry in Colorado. When he was a worker bee in this industry, he had no health insurance. This year they gave him a job as a manager. They deemed him worthy of health insurance. But what about the rest of the workers? You know, why are we content to segregate people? We can no longer accept this. My mom is fighting breast cancer. It's her second time around. Obviously she's covered, she's old. She'll kill me for saying that. She's covered under Medicare. She's done great. She's gotten everything that she needs. It's her second time around that she's a strong lady. But you know, the first time around she was supposed to take tamoxifen. So when I checked with her and I said, hey Mom, you're taking your tamoxifen. Well, guess what? She wasn't because she didn't have it. And she didn't have it because she couldn't afford it. Well, we fixed that. And do you know how we fixed that? We bought the drugs in Canada. That's unbelievable in this country. I'd also like to say that along the line of drugs, when I went to the doctors, I left with a prescription for an antibiotic. So I paid $5 for that antibiotic at the drug, because that's what my copay was. I asked the pharmacist what it would cost if I wasn't insured. He told me it would be $45. I can tell you that my other son spent most of his past year in India working with Tibetan refugees. He had many the occasion to be sick and make some horrible phone calls home, and he had H1N1 in India. He went to a chemist and he bought Zithromax in India, and he paid 54 rupees for it. What 54 rupees is $1.17. Unbelievable. When we look at how we fund, how many people have gone into stores and you see jars at the stores, right? Help Joe, who's fighting cancer. Help Mary, who needs a liver transplant. That's really awesome that that's how Vermonters are, that that's how we look at helping each other. But is that really how we're supposed to take care of healthcare needs, to put jars in stores so people can put their pennies, their quarters, and their dollars in them? I think not. I think there's a better way. We also have heard that a proposal of $20 million being cut from the mental health budget. Within days of that being on the front page of the paper, a chief of a police department was talking about that he needs more money in his budget. And he needs more money in the budget because he's finding with the lack of mental health services that he needs to ramp up. I would say that that just seems inhumane to me. We're going to spend money on mental health, or are we going to spend money on locking people up? It's just unbelievable. I think we're going to spend money on healing people. Steps ahead, what I would say to our legislature is that we are here to do the hard work with you.